Mrs. Gopal has been suffering from asthma since her childhood. As she grew older, she started having more asthma attacks.
I was brought up in Kerala. Then at that time also I had asthma, but not frequently. But when I moved to Delhi for the last 22 years, I felt very much asthmatic attacks regularly, frequently.
Breathing is something we usually never think about when it happens naturally. But when you have trouble breathing, it's the only thing you think of.
And that is what happened with Mrs. Gopal. Since her childhood, she was troubled with asthma. And as it got worse, even simple activities became difficult to do.
You're watching Doctors on Call, and I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta. On World Asthma Week, we'll talk about what is asthma and what can you do about it. Now, normally, your airways are clear and air can flow in and out easily. Asthma is a condition that causes the airways to become swollen, causing trouble breathing. You usually get an attack when your airway comes in contact with an allergen or irritant that could be pollen, dust, smoke, etc. The smooth muscles around the bronchioles or breathing tubes in our lungs begin to tighten and become swollen, causing difficulty in the flow of air and causing trouble breathing. The mucus glands that line the bronchioles secrete a thick mucus that causes the opening to further narrow, producing a wheezing sound as the air moves in and out of the lungs. When this is severe, it can cause an asthma attack. Approximately 20 million people in India suffer from asthma, and one of the most common causes are allergies.
Mrs. Gopal knew she had asthma. Despite being on 9 different medications, including 3 inhalers, her symptoms continued to get worse. This is when she decided to consult Dr. Deepak Talwar, a senior pulmonologist.
Although asthma is a completely controllable and treatable disease, however, about 10% of asthmatics continue to suffer despite the treatment. She also came in a similar situation many years ago, and she was on multiple medications at that point of time. And she was taking all the treatment, but she was not getting relief at that point of time. All the asthma medications these days are in the inhaled route, and many a times we find there is a problem in taking the inhaler properly. After optimizing her therapy, as well as giving her the right medications and right dosages and through the right route, and checking her compliance and the technique as how to use it, we realize that she still continues to suffer. And they suffer perhaps because of the severe exposures to their allergies which are from the environment. So she was also tested for that and found to be allergic to insects, which is quite common in the northern India. Once she was optimized on the treatment, and she still continued to suffer in terms of having recurrent attacks of breathing difficulty as well as bronchospasm, wheezing, we decided to consider her for immunotherapy.
Now, since allergies are one of the most common causes of asthma, another treatment that can be used is immunotherapy.
Allergic asthma is produced because allergen to which the person is allergic to, once it gets introduced in through the environment, by inhalation it goes and sets up an allergic response in the lungs. This response is primarily through the IgE antibody, which is mediating this allergic response. And to make a immunotherapy, we need to make a blocking antibody, which is IgG, against the same allergen. So over a period of time, when the IgG levels rise to the extent where once the allergen enters the circulation, instead of IgE, it is the IgG which is encountered, and that immediately blocks it and does not allow the allergic response to occur. So it is basically trying to fool the body by making it immune by the other antibody which is not producing the allergic response.
In the case of Mrs. Gopal, with the help of immunotherapy and medicines, she was able to get down from 9 medications to 1 medicine.
Now I am taking only 1 inhaler and immunotherapy injection vaccine for once in 6 weeks.
Now we also have immunotherapy available in the form of tablets, and more research is underway to measure their effectiveness.
Now, there is no complete cure for asthma, but with medicines and treatments like immunotherapy, the symptoms can be controlled. Please remember to always consult your doctor before stopping your asthma medicines, even if you feel better, as an asthma attack can happen anytime.
Take care and see you next week.